Bismillah ar-Rahman ar-Rahim. This lecture is about the health information privacy and security and health informatics ethics. Our learning objectives are to define HIPAA, its use and High-Tech Act, identify the basic security principles, describe the related security issues to authentication and identity management, and discuss the potential security breaches and attacks. And also, we will identify the main sections of the IMIA Code of Ethics for Health Information Professionals. And we will describe the complexities in the relationship between ethics, law, culture, and society. And we will describe the different views of ethics in different countries and discuss appropriate health informatics behavior by medical students. Okay, so with the shift towards electronic health records and personal health record, the health information exchanges and web-based health application, all of this advances in technology creates a security challenge. The first and most considerable federal legislation on health privacy and security is called the Health Insurance Portability and Accountability Act, HIPAA, which was introduced in 1996. Then the next important act was the High-Tech Act, which was introduced in 2009. And the last, we have the Meaningful Use Act, which was introduced in 2010. And all of these laws and acts were introduced because of the widespread adoptions of electronic health records in different countries, such as the USA. And this enhanced the efforts of the HIPAA Act by providing the patients with accurate diagnosis and elaborating their effective treatment in a timely manner. And this is from a study was done by Green in 2007. Also, the electronic health record in Saudi Arabia was introduced as part of the national healthcare reform in order specifically to enhance the accountability and efficiency requirement mandated by adoption of HIPAA. And this is from Al-Dosri study 2012. So the development of this act was a result for the widespread adoption of electronic health records and to improve the quality of the healthcare to the patient. So we have three acts or three laws. So we have three main introduction to healthcare security regulations. We have the HIPAA Act, the High-Tech Act, and the Meaningful Use. The HIPAA Act is shortened for the Health Insurance Portability and Accountability Act. It was born in 1996 and it laid much of the groundwork for privacy and also security measures being adapted within the healthcare today. The original intent was to direct how the patient data was used and made available when the patient switched between physicians or insurers. So if a patient need to change his physician or his insurance company, the patient data will be transferred with security and privacy measures uh, according to the HIPAA Act. Um, it included two major rules, which covers the privacy and security of the data. The second regulation is the high-tech, which is under the American Recovery and Reinvestments Act. It was born in 2009. It greatly enhances the patient privacy protections and provides individuals a new right for their health information, and also it strengthens the government uh, ability to enforce the law to protect the patient information. In addition, it accelerates the adoption of electronic health record systems. And the last regulation, the meaningful use, which is a guidelines for electronic health record, and it was born in 2010. It add additional enhancement to the use of certified electronic health records technology in a meaningful manner. So the electronic health records will not be only used to store the patient data. It need to be shared, analyzed, so it can improve the patient health care. So by implementing all of these standards who protect privacy and security, uh, those tools alone, they are not enough to protect the systems and the networks and the data shares for a national healthcare system. And to be able to protect the patient data and share medical records securely, we need to implement other measures and put them in place. So for those organizations which are required to abide by the HIPAA Act, the patient health data and personal information must be protected. So these organizations, we will call them covered entities, because the patient health data and the personal information will be protected and covered by the HIPAA Act. The protections should apply to all personal health information, whether these information were in hard copy records or electronic personal health information, which are stored in on computing systems, or even if the personal health information were a verbal discussions between medical professionals. So the personal health information is the information that identify patient or group of patients. For example, the name of the patient, his medical number, his security insurance number, and the date of birth, the email of the patient. So any information can identify the personal, the patient. It will be under the personal health information, and it must be protected. For example, if physicians were discussing a specific patient case on a crowded elevator, uh, will be a violation for the HIPAA Act, because if they mention the patient name and his medical number, it can be identified by one uh, of the crowd who are on the elevator, and will violate the patient privacy, and it will be considered HIPAA violation. So the covered entities must put safeguards in place to ensure data is not compromised and that is only used for the intended purposes. So the organization, these health organization, they are the covered entities who abide by the HIPAA Act. They need to add safeguards. They need to add security and privacy measures to ensure that the data is not compromised and it cannot be modified, and they are trusted, and also uh, the only used and it is only used for the intended purposes. So any data, it will be justified by its the purpose that will be in improve will be to improve the patient healthcare. The HIPAA rules, it's not designed to and should not hinder the treatment of patients. So it will not be uh, used to uh, prevent or uh, to hinder the treatment of the patient or delay it. It will be used to protect and secure the patient information. So the personal health information can be shared between healthcare providers without the patient authorization in a specific situation where the personal identifiers removed from that information. So any organizations or people who must follow the HIPAA Act, the Privacy and Security Rules, we call it covered entities. For example, the health programs and plans, the healthcare providers who conduct business electronically, most of the doctors, clinics, hospitals, psychologists, chiropractors, nursing homes, pharmacies, and dentists. Also, the healthcare clearinghouse. The healthcare clearinghouses, they are companies that function as intermediate between the healthcare provider and the insurance companies. These companies can process the claims information forwarded by the healthcare provider and translate it to the insurance payers to pay the price or the cost of the health plan or healthcare of the patient. We call it clearing houses, or we call these companies clearing houses. Currently, at the Kingdom of Saudi Arabia, there is a building. They are building a claims clearing house hosted by the Cooperative Council of Health Insurance. So, what are the consumer rights under the HIPAA Act, or the consumer here? We means the patient. What are the patient rights under the HIPAA Act? So, any covered entities comply with a certain consumer patient right under the HIPAA Act. Specifically, a patient have the right to ask to see and get a copy of their health records. So any patient need to have access or a copy of his health records, he will be allowed, and also have corrections added to their health information. So, for example, if there is a wrong information, he can correct it, but they cannot change um uh, a health information, such as if the patient was smoker and it was recorded at the health records that this patient is a smoker. He cannot remove this information from his health information. Uh, Receive a notice that discusses how health information may be used and shared. So he need, if there is a plan to share his health information, he need to have uh, provided with a notice that discuss how his health information will be used and shared between the organizations. And the patient can provide permission on whatever health information can be used or shared for certain purposes, such as for marketing or research. So they need to have the patient permission before sharing his information for certain purposes, like for marketing or research purpose. Uh, Also, the patient can have or get reports on when and why health information was shared for certain purposes, and he can file a complaint uh, complied with a provider or health insurance if the patient rights are being denied or health information is not being protected. So whenever there was a violation for violation for his information or for the patient information, he can complain, and this complaint he can provide it to the healthcare provider or to the health insurance company, and disciplinary measures can be taken in place. So the HIPAA Act has two major rules. We have the privacy rule and the security rule. The privacy rule strictly limits how a covered entity and any associate business can use the patient data. So it protects the privacy of the personal health information in all forms by establishing national measures and standards. Uh, so there is a method that can be employed and use and release the data without restrictions by de-identifying the data and removing any identifiers which pointed to a specific patient, such as the names, the telephone numbers, electronic mail addresses, and medical record numbers. Um, so this is can be under the personal health information disclosure standards, and any improper disclosure and misuse of the personal health information will get penalties. And also we will have standard to define the patient access right to their health record and information. The security rule, on the other hand, uh, it defines general standards that covered entities must implement to protect their patient electronic personal health information. So there are three safeguards categories that are required by the HIPAA security rule that serves as a foundation, such as administrative and physical and technical safeguards. When the HIPAA was passed in 1996, most of the healthcare organizations were still using the paper-based system, but with the technology, evolved of technology. Um, uh, they need methods to use and share and store medical information electronically. The patient records and personal data storage was becoming more common practice, but there was cases where patient or data was lost and stolen from devices, from laptops, uh, and these cases will allow the disclosure of important information and patient data. Uh, as a result of these breaches or cases, the HIPAA security standard enacted in 2003, and they clarify the requirements for storing and sharing electronic personal health information. So the administrative, physical, and technical safeguards, it guarantee uh, the confidentiality and integrity and availability of the electronic personal health information. So there are three pillars of information security that are fundamental to protect electronic personal health information and information technology solutions such as the health information technology. These pillars are the CIA of electronic personal health information, C for confidentiality, and I for integrity, and A for availability. The confidentiality um, is about ensuring that the privacy of the electronic personal health information is protected. So there will be a safeguards implemented by the covered entities to ensure that personal health information, electronic personal health information, is not made available or accessible or disclosed to unauthorized individuals. So any users who don't need to access the electronic personal health information for a specific patient, they will be prevented from that. So, for example, lab staff who processing the patient test they does not need the full access to patient information such as his name because this information is not vital for the task of the lab staff. And also the healthcare, another example is where the healthcare professional using his position or her position to access a record of a patient or co-worker and gossip about the results. Um, this case will be considered as a violating the HIPAA Act, and the staff, he or her could be suspended or terminated by the organization. So the common measures to ensure confidentiality, we have the authentication and identity management and encryption. The authentication and identity management where we try to make sure that the user is the who are saying he is, and prove that by using measures like user ID and passwords, biometric verifications, and tokens. biometric verification, like using the voice implement and the fingerprint of the user. Tokens will be things carried by the user. The second measure is the encryption, where we will make the the electronic personal health information encrypted if there was an unauthorized access to the information. The encryption is a process where we make uh, the data unreadable or unuseful. The integrity describes the trustworthiness and the permanence of data. So it provides an assurance that the lab results or personal medical history of the patient cannot be modified by unauthorized entities or corrupted by a poorly designed process or system. The common measures to ensure the integrity by using user permissions and access controls. So there will be users who are having privileges and different access controls to prevent data manipulation by unauthorized user. And also, this can be like when you are using the Blackboard system. So your user access is considered under the student group, and you have limited access to the or limited uh, task or features that you can use on the Blackboard. You can download content or learning content materials. You cannot set up a test, but for us, the faculty, we have a different access level where we will be allowed to have more features, such as set up a test and assignment, sending announcement. Also, there will be administrator level or access level to enroll the student in specific course. The version control is to prevent wrong changes or accidental deletion by authorized users. So, for example, if some information were uh, deleted or erased accidentally by a user, we will have a control on the version where we can recover the deleted data. Backups and archival tools or redundancies, they must be available to restore the affected data to its correct state. So we can use the backups and any archival tools to return back to the correct version or the correct state. Checksum here to detect any changes in data due to transmission or human or unhuman errors. So any changes or any modifications on the data will be detected and recorded to make sure that the data integrity. So data integrity is all about making or make sure that the data are correct and not modifiable by any unauthorized users. Because if we didn't make sure that the data is correct, we will have bad data where the data will be duplicated or missing or incorrect and inaccurate data. And based on the bad data, we cannot take a right decisions. The third pillar, availability, it refers to system and network accessibility to all users to retrieve information, and often focuses on the power loss, the network connectivity outages, and hardware problems. So the loss of availability may be attributed to natural or accidental disasters such as tornadoes, earthquakes, hurricanes, or fire. But also it referred to the man-made scenarios, because sometimes we will have attack or malicious infection, which can compromise the network and prevent the users, the authorized users, from using the system or accessing the system. The common measures to ensure the availability of the system, uh, we will have backup generators or servers. So if something happen and made the system unavailable, we can use the backup server or a backup uh, generator, electrical generator, to prevent the loss of availability of the system. Uh, the second measure is using peripheral network security equipment such as the firewall. It will be used to prevent availability loss due to an attack by protecting the security network equipment. And also we can maintain that all hardwares and performing hardware repairs immediately. So whenever we have a hardware uh, uh, in bad shape, we can change it and repair and fix the hardwares that need to be fixed. Fast and adaptive disaster recovery plans. So any system need a disaster recovery plans to have an emergency plan that can be used and followed during a disaster. Uh, and the users of the system need to be trained and be aware about this plan for to implement a fast and adapt the plan in a short period. So we will return to the confidentiality pillar, where we say that we can use the authentication and identity management as a measure to make sure or to protect the data. The identity management, they are tools that help to identify who are you, and more importantly, can you prove who you say you are? So we need to identify the user and prove, and also to have a proof that the user is who said he is. The authentication, this is a process that tries to verify that the user has the claimed identity. So this is the proof that the user the user is having the claimed identity. And the authenticated users or patients or staff, they are uh, the authentication of the users, patients, and staff, they are is essential for providing system access and ensure that only those who need to access or who need to have to know about the data have access to the data and protect important data. And also it's important to apply legal actions and records any action to the records. So the authentication can be accomplished with photo identification, like the badge that you have, the ID badge that has your photo, to authenticate that you are a student at the university. Biometrics, so using a biometrics measure, so by using the fingerprints, the voice imprint, the face of the user, smart card technologies and tokens. These are something the user will have and carry. And we have also the audit standard by using the username and password. The authentication procedures may vary depending on the sensitivity of the data. So if we have a very sensitive data, we can apply more than one authentication measures, or we can choose the authentication measures that have that can protect or it apply higher protection. Also, the capabilities of the system and the resources which are available will be constrained on the uh, uh, authentication procedures. The resource constraint, for example, the technical, the available system, the available devices and technology at the organization, and monetary, which is the money or the budget that available to apply the authentication procedures, and also the frequency of access, how many times you will use this authentication procedure. The authentication methods, we have two or multi-factor authentication. So we can verify the user identity by requiring a combination of two or more of below factors to add more levels to the security. So if we have a very sensitive data, we can have multi-factor authentication. The factors are something the user knows, like the password or a private key. So the password or the private key will be known by the user. No one else will know this password or the private key of the user. Something the user has, this is like a magnetic card or physical key, like when we are locking the door, our house door or the office door with a physical key. This is something the user has. And the magnetic card, like your ID card and also your ATM card, the debit card, the credit card, all are all of these are magnetic cards that the user has or carry. Something about the user. This is a physical trait like the fingerprint or the voice print or the picture of the user. Example of two-factor authentication is the username and password combination, which is still employed by the majority of systems and users today, which combine two things that the user know, the username and the password. So the username and the password will be known by the user. Another option is by utilizing a grid card, a smart card, USB token, and one-time password token or one-time password service in combination with something a user knows, uh, such as the passphrase or PIN or password. So these are two factors authentication, and we can apply more than two-factor uh, authentication based on the sensitivity of the data. So this slide, we have various authentication tools. We can apply one or multi tool for authentication, and these authentication tools showing a grid card. We have also smart card and OTP service, and also the OTP token, and also we have the USB token. The grid card is provided to the user by from the system on a wallet size card that contains randomly generated characters in rows and in columns. The user logs in with his username, so he will have his username, his password. Then he need to input some required characters selected by the column and cell number. So for example, we need the user to enter the character which fall into the column A, row 2. So it will be the M. And we need the user to enter the character who falls into column C and row 4, which is number 2, and the character who falls into the column F and row 3, which is number 6. And by entering these characters, the user will be granted the access to the system. The USB token, it acts like electronic key to access something. So it has a built-in screen to display generated authentication data. We can see the data on the screen, and the user can enter manually the characters generated by the token using a keyboard or keypad. The one-time password, we have one-time password service and one-time password token. So here, the one-time password here is a password that is valid for only one login session or transaction on a computer system or any other digital device. So, like for example, when you have or when you want to access your bank app from your smartphone, you need to enter your username and the password. Then some of the banks will send you one-time password to your smartphone, which will be characters and numbers that are valid for using for only one time.
login. So you can enter the received characters and you will be granted. Sometime the system will provide you with a token that will be used to generate a one-time password every time you need to log in to the system. The smart card, this is another authentication tool, and we will talk about it in detail. We have different smart card example, like the ID of a person. Also, we have the ATM, the debit cards or the credit cards. Uh, will have will be a smart card. So these are examples for the smart cards.
Another authentication method, the single sign-on SSO, where the users will be allowed to access many systems or different systems and resources by using one set of credentials. Uh, every day, he can use it every day securely. And one example or one common example of SSO is the service offered by Google to partner organizations with which use Google apps such as the Gmail and the G Drive, the Google Docs. We have also the contacts and a lot of resources, the Hangout. All of these systems can be accessed by using one Gmail, Google user name and password. And another example is when you are using your username and your password to access the Blackboard and to access the computers in the computer lab, and also to access the SIS system. You are using one username and one password. The smart cards The smart cards which are used in healthcare comes in different countries. There are many countries they use the smart card. So the smart card can carry vital information, and it will be uh, in also it will have a self-contained processor and memory. تكون في وحدة معالجة وذاكرة في السمارت كارد. The smart card advantages are the low cost of the card and the ease of use, so it's easy to use a smart card, and portability and durability. It can last for many years, and it can be carried, and the ability to support multiple applications, so we can use it to access many systems, and also it's capable of providing confidentiality by encrypting the patient information, the biometric signature, and the personal identification number. All of these information can be encrypted in the smart card. The drawbacks are the lack of standardization, so we cannot standardize the smart card to make it universal. Smart cards in healthcare. So the smart card in healthcare can be used to identify the staff and also uh, to store information about the patient. Uh, it's a portable physical electronic authorization device, and it's used to control access to a resource. Um, it's typically a plastic credit card sized card with embedded integrated circuit اللي هي الدارة الكهربائية IC. This is wires running from the computer chip under the service, and uh, this chip it has a self-contained processor and memory. Uh, Typically, the smart cards are read by direct physical contact with a card reader, or sometime we don't need the direct physical contact because it can read the card through a remote radio frequency interface. Many smart cards they include a pattern of metal uh, contacts to electrically connect the internal chip with the card reader. And a smart card can provide personal identification, authentication, data storage, and application processing. Um, so the whole piece of the IC will be embedded into a plastic card or USB token. And the smart card technology, it uses a computer and software with 100 of built-in security features, so it can protect the information. Examples of the patient data that can be stored on the card are patient identity verification, complete patient demographics, allergies, medications, known medical issues, surgeries and procedures, additional patient information such as implanted devices and insurance information. The applications include uh, identification, financial, mobile phones, the SIM, the public transit, the computer security schools, and healthcare. These are applications for the smart card. Other authentication methods, we have the biometric uh, authentication. Uh, so this is a security process that relies on uh, the unique biological characters of the individual to verify that he is who is saying he or she. When combined with passphrase, the tokens, cards, and the one-time password solutions, or a two or multi-factor authentication solution can be employed. Example of the physical user identifiers, we have the fingerprint, and we have retina scan, where there is a device can scan your retina, and face recognition. This is an authentication method used by smartphones now, or available at the new smartphones, and also the fingerprint authentication. You can find it in smartphone and also in attendance systems, uh, and also the new laptops or uh, technology computer devices. Also, we have the voice implement, where the user will record his voice, and by using a voice recognition system, we can make sure that the user who is saying he is by recording his voice. And this voice recognition, it can you can one of its application in the smartphones when you want to control Siri, which is a voice recognition application that help you to uh, give commands to your smartphones and create action. Example of security attacks, we have the physical theft. So computer devices such as laptops, computers, storage devices, and servers can be stolen. Uh, and each year there is cases about storing computer devices uh, from cars, homes, and place of business. Um, and also we have the for physical or logical access by insider threat. Here, the insider threat can be defined as those employees or staff with physical or logical uh, access to systems in an organization who seek to steal, damage, or compromise the data. So the insider employee or the staff, they pose threat by using their privileges to disclose the personal health information to unauthorized parties. Sometimes uh, we uh, we will have an angry employee who seek retribution, and someone who want to uh, gain amount of money by selling a data collection, or also an insider seek data for another or other competitive or cooperate organization for spying purposes. So for hospitals, this threat could extend to data corruption, similar to what happened at a Minnesota hospital when an angry former employee planted a logic bomb in uh, the system which the hospital system which disabled a core program. Here this is uh, one example of physical or logical access by insider threat. Then we have accidental, negligent, or careless disclosure. The accidental release of sensitive information to unauthorized parties is when the information uh, accidentally exposed to unauthorized party without the that without any intentions to expose or to release the sensitive information. And sometimes or many of the data breaches were a result for accidental or negligent uh, uh, matter. This type of exposure or leak can occur through inadequate control of paper records. So the paper records are not protected enough or put in safe places. In inadvertent release of sensitive information to an authorized party, sometimes through overheard conversations, or even poor housekeeping practices around the copiers, fax machines, and recycling bins, because people sometimes they throw sensitive information in or forget sensitive information in copy machines or fax machine and recycle bins. Uh, Here, another party or an unauthorized user can have the access to the sensitive information. So, protected health information that is transmitted in non-secure means across networks or through email messages without the proper levels of protection or adequate de-identification. They are also example of electronic disclosure. And we have the intrusions attacks. They are attacks on physical machine and wireless networks, attempting to compromise machines and users account to result in data loss or exposure. So sometimes you will have attack from outside the organization by a hacker uh, who are uh, intending to compromise, damage the computing devices, the network, the systems, or sometimes they will delete the data or expose the data or steal it and sell it to unauthorized parties. So to prevent these theft attacks, we need to have countermeasures, such as the stolen data should be uh, rendered unusable to thieves, so it will be unusable and also unreadable to the user by applying encryption standards and techniques such as FIPS 140-2 standard, which can be used to make stolen data unusable whenever we have an attack on a specific system or device. So the FIPS 140 dash 2, this is encryption standards which being applied to storage mandates in order for organization who are following the HIPAA data protection criteria in the event of loss or theft. Simply, we have encryption, which make the stored data irretrievable or otherwise difficult to understand to those who attempt to access it without proper decryption key. So if it's not the intended user or the authorized user to access the data, he will not have the decrypted key to make to have an access to the data. Uh, so this measure can be adapted by in hardware level by devices. So it can combines uh, the physical storage devices to be applied on drives found in servers, workstation, and portable computing devices. So it applied different standard security standard measure using the encryption to make the stolen data unusable. The health information ethics, they are the ethical issues resulting from the use of technology in managing healthcare information. So, the health informatics studies the healthcare information and communication, and both of them have been greatly affected in recent years by the use of computers, the web, uh, by both the clinician and the patients. So many practices now they use the electronic medical records and the computerized provider order entry systems, and patients often serve the web seeking health information and search uh, about their condition and diagnosis. But some uses of the computers in healthcare they are controversial and rise ethical concerns, especially when patient safety and outcomes are at stake. So, because the profession is relatively new and evolving rapidly, and this is as a result to the fast-moving technological advances, keeping up with the legal and ethical issues can be a challenge. And the healthcare workers and consultant, the health policymakers, the medical researchers are only a few of the professional committees they are who are affected by shifting regulations and laws and ethical guidelines. So the dynamics of power remind us that uh, uh, healthcare informatics uh, should structure and use data, information, and knowledge ethically and responsibly. Uh, so in 1997, Severson introduced four principles of information ethics. Uh, the first principle, respect for information property. So we will respect the ownership of the information, um, respect for privacy, and this is means that one's personal identity must be protected. Um, Fair representation. Here it means one must be able to trust what the physician says about his plan of care and his test. The last principle, non-maleficence, do no harm, and it means doing no harm, and this is uh, an important principle where we must never do anything that might contribute to the decline of another person's life or affairs. So by applying these principles in healthcare informatics, uh, here we will have a special case because of the relationship between the electronic health record and the patient. Because the patient information is private, and because the information forms the basis of decisions that have a great impact on the welfare of the patient. So, in addition, this data is used to guide policy in healthcare institutions, governments, and other important agencies. So, the International Medical Informatics Association, the IMIA Code of Ethics. It includes principles of information privacy and disposition, openness, security, access, legitimate infringement, and least intrusive alternative and accountability. So the code of ethics is a conduct that provide a guidelines for the professionals to include safeguardings of privacy and security of health information, and the disclosure of the health information, the development and use and the maintenance of health information, and ensuring the accessibility and the integrity of the health information. So this principle relates to the notion of that all persons have a fundamental right to privacy. Um, so he has a control over the collection, the storage, the access, the use, the communication, the manipulation, and the disposition of data about themselves by these principles. So the ethics are influenced by a country's laws and culture. The relationship between the ethics, law, culture, and society is unclear because it's not fixed internationally, and it may be fluid even. Uh, Maybe fluid even within a given country over the time. So ethics can be different in the same country from a region to another region. Uh, we can uh, define the ethics as the set of moral principles that guide the person's behavior. These morals are shaped by social norms, cultural practices, and religious influences. Uh, Ethics, they reflect the beliefs about what is right, what is wrong, what is just, and what is unjust, what is good and what is bad in terms of human behavior. So the ethics serve as a compass to direct how the people should behave toward each other, understand and fulfill their obligations to the society or the community. So the key difference between law and ethics is that law and ethics are not the same thing. Uh, Both exist to influence the behavior, but complying with the law is mandatory. So you need to follow the law, while adhering to the ethical code is voluntary. So it returns to the person if he want to follow uh, his ethics or an ethical code. It's not mandatory like the law, it's voluntary. The ethics is personal, and most people don't care to ask about the another person ethics. Law, on the other hand, is social and monitored by a justice system, the government, and the police force. Uh, the culture, on the other hand, describes a collective ways of life or way of doing things. It's the sum of attitudes, values, goals, and practices shared by individuals in a group, organization, or society. The cultures vary over time periods between countries and geographic regions and among groups and organizations. It's defined by everything from language, religion, social habits, music, arts, which vary over time periods from different countries or regions. So we have three broad different views of ethics and regarding the relationship between ethics, law, culture, and society. The first view is where ethics does not exist outside the law and exists only for the good of a properly ordered and legal society. For example, um, there is no uh, ethics code where it tells us where the driver seat should be in the car. For example, in Saudi Arabia, the driver seat will be on the left, and in UK, the driver seat will be on the right. Uh, there is no morality issue wherever how tell us or say anything about the side of the driver seat, uh, but it was but it is in the law uh, of the country. All the driver seat in Saudi Arabia should be on the left, and in UK all the driver seat should be on the right, and this is for to order the society and to regulate the traffic. The second view is where the ethics are usually strongly informed by the law, society, and the prevailing culture, and are extensions of these. So there are ethical requirements that are not necessarily required by law, but what is ethical can never conflict with what is legally required. Lying, for example, is not illegal, but most of the people would say or agree that lying is morally wrong. So uh, the law will not forbidding anyone from telling a lie, but the ethics or the moral issues of the society uh, and sometimes the religious will tell the person to tell the truth or forbid the lying. The last view uh, is ethics is when the ethics exist entirely outside the law, and it's a matter of personal consciousness where there is a conflict. So where there is a conflict, the ethical viewpoint must prevail and followed. Uh, so because here the ethics, it grows from within the social practices, uh, there is usually correspondences between ethics and the law. And where there is conflict, we must follow the viewpoint of the ethical viewpoint. Uh, for example, we have the medical experiments which were carried by the Nazi doctor during the World War II. Uh, the Nazi doctors were in compliance with the law and legal instructions from the government, the Nazi government. They usually conduct medical experiments on the uh, some population, such are the Gypsies, the Jewish, uh, and people with special needs or disabilities or mental health problems. Uh, they will perform a medical experiment on them without uh, their permission. Uh, these doctors were following the law from the Nazi government, but the first ethic ethics principle in medicine was do not harm. So they shouldn't do anything that harm their patient or their subject. Um, Also, there were experiment conducted by medical staff from Japan uh, on the Chinese population during the World War II. Uh, they conduct these experiments on prisoners to train the doctors on procedures to save the lives of their soldiers. Uh, in US, United States, until the late of 1970s, there were a law that can sterilize people for various reasons, including being poor. So if we have a poor person, he will be sterilized, and he will be forbidden from having kids, or if the person was having mental problems, or young girls who had been raped, they will be sterilized under the law. And also, the USA had conducted medical experiments on on humans who were not fully informed, and they could not give their informed consent or their permission. Um some had been conducted before the war, but many continued well after. Uh, there were syphilis experiments which was conducted on Guatemala, and also some other experiment on disabled children, and the radiation experiments on the American citizen. So all of these, uh, it is a moral ethics to do not harm a person or a patient, but doctors were allowed or were following the rules from the government by to do these medical experiment, which can be a torture or can kill their patient. So the code of ethics is only a code of ethics. It carries, there is no legal weight at all. If the person is found to be acting unethically, then the organization and the institution may take actions such as revoking his license and refusing permission to practice, or uh, suspension of the staff, and this is the actions and their powers, but the person must be guilty of committing a crime in order to be punished in the court of law. So the code of ethics refer to always place their ethics in the context of law. For example, confidentiality requirement exists unless otherwise demanded by law. So, if the law or the government ask for any confidential information, it will be exposed, and this is by demanding of the law. So here we have a health informatics ethics and health sciences student. Uh, these ethics or these code of ethics, the medical or health student should follow. Uh, uh, First, students should be careful about online comments and photographs of themselves, colleagues, and patients on social networks. So, when you are talking to a colleague or a patient, you need to be more careful to not disclose sensitive information. Uh, Also, um, you cannot uh, threaten or take picture of a patient uh, and post it online. And here we have some example about that where we have tweets. Um Student post. Here, this is a student who threatened his uh, lecturer for a poor uh, grade, and here there was investigation with uh, a staff who took a selfie in an operation room, and this exposed the sensitive information and the patient information. Uh, the care in the use of mobile devices with cameras. So it's an it's ethically to take permissions if you want to uh, take photos with your camera, uh, and uh, you need to avoid plagiarism, no cheating. You cannot uh, uh, take or copy a copyrighted content into your assignments or articles without mentioning or giving credit to the source or to the um and the citation of the source. Avoid using pirated digital files. So copyrighted files such as music, video files um, uh, are protected by the copyright, and copying it without the permission of the uh, owners of the file consider uh, a theft, and it's not allowed. Um, Avoid recording of lectures without consent. So before recording any lecture, you need to ask the permission to record it from the lecturer. Manipulation of electronic files. You cannot change uh, data for um, and modify or delete or damage electronic files, uh, and ensure the copyright is not violated. Make sure that any protected uh, uh, element with copyright is not violated uh, uh, by not mentioning the source. Avoid accessing documents illegally. So you need to avoid access to any document without the permission of the owner of the document, uh, because it considered uh, unethical. Uh, and this is the last slide in our lecture. Uh, if you have any questions about both of the lectures, uh, tomorrow on Thursday during the lecture time from 12 p.m. to 2, I will be available on uh, live session using the Blackboard Collaborate or Microsoft Teams. So uh, please, I want you to watch the video and hear the lectures. Write your questions or to discuss them tomorrow, and also you can post any questions regarding the uh, both of the lectures um on the discussion board. Uh, I hope you enjoy your lecture, and stay safe. Assalamu alaikum wa rahmatullahi wa barakatuh.